Hey guys, I just wanted to do a quick explanation of one little thing. A few very, very observant people have noticed that Alice has a birthmark at the top of her head. And I wanted to explain a little bit about what it is and what we know about it. It's called a strawberry hemangioma, and it's a superficial collection of blood vessels that for whatever reason just have formed. I can show you. There it is. She wants to look in the camera. There it is. So Alice's is just a little bit smaller than the size of a dime. She was not born with it. We first noticed it when she was probably about 5 days old, and it was just a totally flush little pink spot, very, very small. And it has grown since then. They typically will grow over time for the first 6 months or first year of life, and then most hemangiomas will gradually start to shrink and flatten out and get lighter in color, and most eventually disappear. It is not serious in any way. It doesn't run in families. It's just one of those things that happens. They're actually fairly common. They occur in like 2 to 5% of babies, and they're more common in girls. And they are most commonly on the head and neck. So Alice was just one of the lucky ones. Huh. It doesn't hurt her in any way, and the only concern we have about it is if she hits her head and it starts bleeding, it will bleed a lot because they are blood vessels. So it's something that we're going to keep an eye on, but overall she doesn't have any restrictions or isn't affected by it in any way. Hemangiomas can be serious if they are internal. Babies can have internal bleeding from them, and also if they're in sort of sensitive parts like the mouth, around the eyes, in the ears, that kind of stuff. But as far as we know, Alice doesn't have any of those. She just has the one on her head, and I'm really not concerned about it. I know some parents can get upset that their child is going to be made fun of or something, but really, in the grand scheme of things, it's totally minor. It's just not something we're worried about at all. They do generally go away by age. Well, we've heard different things. Some say by age 5, I've heard up to age 10, and I've even heard, I think depending on the size and stuff, it can be into your teens. But where Alice's is, her hair is probably going to cover it up pretty soon. And it's something that people ask about, and she'll get asked about from other kids, but my mom likes to say that that's where she was touched by an angel. So just so you know what that's about. Huh. If your baby has one, or if you see one on another baby, that's the story.